There you go. Good. Okay, good. All right. Any difference that you're feeling right now?
Yeah, I don't feel the pain in my toes.
Okay, good. So the lower back, point to me where you feel the pain. Where does it travel to? Where does it start?
So it starts here
Okay.
and it travels all the way through here.
Into the groin area.
Yeah,
Okay.
but lately it's been shooting down to almost my feet. Like when I walk, I can feel it all the way up.
Okay. So is it just the right side?
Yeah, just the right
Okay.
side. I mean, the left side hurts, but not like the right
Not
side.
like the right side. Okay. In terms of your neck, where do you feel the neck pain?
Through here. And I've been noticing, I don't know if this has anything to do with it, but like there's a bump that comes right here.
Mm-hmm.
I don't know if that has anything to do with it, but I feel it through here and like down through my arm.
Yeah. Okay. You said 6th grade. That was when you fell.
Mm-hmm.
So you're snowboarding, you said?
Yes.
Okay. So when you fell, you remember falling on your tailbone?
Yes, I remember specifically falling backwards right on my tailbone
Uh-huh.
and then right on my head.
Okay. All right. So like I mentioned, that is possibly the first injury that may have caused what we call the spondylolisthesis, right? So the spondy, where that bone shifts forward, and that's what we're looking at here. Looking at your spine, I think we talked about this last time you were here. This side sticks out just a little bit more, and you'll notice that there is some rotation that's happening within your spine. So basically, looking from top down, it kind of sticks out more, so it's rotating out like that.
Mm-hmm.
And so this is where you're going to see a little bit more stress on the mid back, but a lot of this stuff from here oftentimes stems from the lower back. Even the muscles here,
Mm-hmm.
you can see this side sticks out a little bit more than the left side as well. Okay, that's right there. Yeah, so your lower neck is about C6 area. We'll take a look at that. You got a lot of heat waves going through the muscles here. Yeah, so this is where you're going to see S2, 1, 2. Any soreness on those ones?
On the one.
On the one there. Okay. Why don't you take a look at the right pelvis here as well? Sore at all there?
Uh-huh.
That's where you feel a lot of it?
Uh-huh.
Yeah. And this one?
Uh-huh. There too.
Yeah. So to play it safe, we're going to start with your sacrum.
Uh-huh.
That is where we're going to see the biggest, I think, effect in your spine. But that pelvis on the right might need to be adjusted later on as well.
Yeah.
Just to start, we're going to start slow.
Okay.
We're going to start with your sacrum. And we're also going to work on that C7 today. All right. So I want to get really nice and low from the joint. I don't want to get onto that L5, so it's going to be better to get lower here. So
Okay.
that's S1, S2. Right there. Now we're going to be scooping in our knees, and we're going to just leg up just a little bit there. I'm going to roll you just a little bit. I won't drop you here. And all the way. There you go. So all you're going to do is relax in there. There you are.
Sorry.
You're okay. Good. There you go. There it is. Good. Little piece. One more here.
Breathing, Christian.
Good. There you go. Good. Okay, good. Alright. Let's get you walking on that. So I'm going to walk back towards the chair, or the wall. You're going to walk back towards me. Okay. And then one more time, going back. We're going to get you walking back and forth on this and get some movement in there. And back. Okay, and then one more time. Any difference that you're feeling right now?
Yeah, I don't feel the pain in my toes.
Okay, good. Last one over here. And you gotta have a seat for me. I want to take a look at the movement here. So, with this joint and the lower back, I'm not expecting a lot of popping with this one.
Uh-huh.
And the reason why is because the disc is so small. Okay,
Oh,
there's
okay.
not much disc left in that joint. But the other thing is too, is because those joints are so separated,
Uh-huh.
they're not going to cavitate as much.
Oh,
Okay,
uh-huh.
but we did get some movement in that, and so that one I'm actually pretty happy with that just to start. Yeah, even the movement seems to be just a little bit better on that too. The one that's our biggest concern is going to be this guy right here. Now, again, we talked about the spondylolisthesis, how that joint's shifted or sloped forward. There's not much joint space, so we're not going to hear a big old pop or crack. But my job is just to try to shift that joint underneath it and scoop it underneath it to try to get as much relief as possible.
Okay.
How much relief? That's going to be up to your body. But our goal is to try to stabilize that joint. Okay, so that's where we're going to leave it at today. I would like to see you again. Are we able to come back in tomorrow?
Yeah, tomorrow.
Okay. I want to try to get more pressure off of that tomorrow. The key for you right now, we're not going to add in a lot of stuff. I just want you to get some movement in the joints. Do you
Okay.
go for walks at all?
Uh-huh.
Okay, walking is the best form of exercise.
Okay.
And the reason why is because when we get pressure off of that joint a little bit, movement allows that process to continue. Okay, so walking, that's going to help to push out some of the inflammation, but it will allow that process to happen where it's going to start to unwind and unlock a lot of the stress that's been going on. Okay, ice is another thing.
I've been doing heat.
So ice is probably the best thing right now because it's a vasoconstrictor. So when there's inflammation, there's fluid, there's swelling, heat will bring in more fluid. Ice is a vasoconstrictor, so it helps to push out some of the inflammation, and that will help to numb and cool down the area here. Okay. Heat can be beneficial in some circumstances, but right now I would like to see ice right now.
What about at nighttime when I wake up in pain? And do you want me to do ice then too? Or
I would like to see you try ice.
Okay.
If you do find that heat is helping you, at that point, you just do whatever's going to help the most. You've had enough experience with heat to know that that would help you. So if you do feel like you need some heat, go with heat.
Okay.
But I would try ice too, just to see if that will help a little bit as well. Okay. But the biggest thing is just trying to reduce as much inflammation as possible.
Yeah.
Now later on, as we get a little movement in the joints, I will want to start seeing you start to strengthen your core.
Yes.
We'll give you some exercises for that as well. And it's not going to be like the crunches and the sit-ups. That's not going to help you at all. It's going to be more so specific exercises that are just going to stabilize the joints around it, the muscles around it. We're not just trying to squeeze the abs here. We're going to contract the entire muscle. Okay. But right now, walking, ice, and then how's your water intake?
I drink a lot of water.
So
I drink a lot of water.
Okay, keep that up then. So that's going to be it for right now. Okay, so ice and walking.
And how much walking a day?
It depends on the person. How much do you feel like you're able to walk?
Well, I usually do 30 minutes on the treadmill at the gym.
Okay.
Is that enough, or do I need to do more?
I usually will recommend bringing down whatever your max capacity is that you usually do, bring it down to about 70%. So I would say maybe about 25 minutes to do that. If you're doing fine at 25 minutes for the next couple of days, go back to 30 minutes.
Okay.